You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic, Dr. Sepiashvili. Welcome to the program.
Pleasure to be with you, Randy.
Now, I know you brought some photos,
right.
And so before we get to those, we'll get in as many of those as we can.
Sure.
For people that don't know your practice, who's coming in actually for dental implants?
Well, we're a husband and wife team, and we are surrounded by a very caring and dedicated team of people that work with us. And we take care of patients coming in with all different kind of problems, missing teeth, broken down teeth. People have been through the ringer, have seen dentist after dentist after dentist, and they're still not comfortable. They don't like their smile, they can't chew what they want to chew, they can't eat, they can't laugh the way they want to. So we try to give them what they want. We try to give them a beautiful, healthy, natural smile.
Okay, now your wife, she's also a dentist. Is
Yes.
that right? Now, do you do both of pretty much the same thing within the practice, or she does one thing, you do another thing?
Well, we both do the same thing, and we asked our patients what they would like, and all of us hear the same thing. They don't want to go from place to place. They want to be able to see the dentist that they trust. They don't want to go one specialist, another specialist. So we customize that process that we're fortunate that we can take care of all their needs within our practice.
So you have this concept of doing it all right there.
That's right.
Now, when it comes to dental implants, correct me if I'm wrong, that normally you go to one place, how it's typically done, one place that does the surgery, and then another dentist that puts the tooth on top. You do it both right there.
Yeah, and actually the process sometimes is even more complicated. You go to one place to do a CAT scan, then you go to a surgeon to place the implants, then you go to the restorative dentist for him to put the teeth on top of those implants. Really, who wants to go from place to place to place?
And plus, nobody likes going to the dentist.
No, nobody likes to go to the dentist, and people want to be able to go to one place, put their trust into one person, and have that person do whatever needs to be done.
And you could do it one day. In fact, we talked on the phone. You said people can walk in without teeth.
Correct.
And on the day of the procedure, can walk out with teeth that don't come in and out.
Yeah, it's amazing.
Is that right?
Yeah, amazing. This kind of thing, we couldn't do that 20, 30 years ago. Now, there is really no need for people to walk around with removable teeth. I honestly believe that a few years from now, everything will be attached. You won't have to take teeth out, put them in a little jar, or worry about whether they're gonna come flying out every time you wanna yawn or whistle. So everything will be attached, hopefully, and that technology is here now, that technique is here now, and we're very excited to.
Are there a lot of people where you are wearing dentures? Or headed to dentures?
Yeah.
Really?
I mean, sure. We're in New York suburb. You can probably fill giant stadium with people who are missing teeth, have ill-fitting dentures, have teeth that have to go, that they're gonna have to get a replacement. So yeah, absolutely.
So for the denture wearers, for a moment.
Yeah.
Okay. That if it's so good then to get them fixed to dental implants, why aren't they all doing it?
Oh. That's a great question, really, but there are different reasons people don't do it. First of all, you gotta understand, people who have dentures, they kind of fall off the wagon. They don't see dentists anymore. They've gotten those dentures a few years back. Some of them don't even know that there is an alternative, like having dentures attached to something. So
because they don't go to the dentist.
They don't go to the
Okay.
dentist. Some of these people have been through a lot of really unpleasant experiences. They've had a root canal, then they had a crown, then that root canal failed, then they got the replacement for that tooth, then they did the same thing with another tooth, and they've been in and out of the office, expense after expense, treatment after treatment, and honestly, for them, it's a relief when they don't have to see the dentist anymore.
When they get all their teeth taken out.
Yeah, for them, it may not be the best thing, but I don't have to deal with you guys anymore, with dentists. But they're missing out on comfort. They're missing out on how good really life can be. With something that is attached and doesn't have to come out. Another reason people are scared. People are afraid of discomfort, afraid of going through the procedure.
Seems very painful.
Well, during the procedure, Randy, you feel nothing. We can give you a pill even the night before, so you are relaxed when you get to the office.
Do people do that?
Yeah, absolutely. People love it. They have very little recollection of what actually happened during the procedure. We called it the rainbows and lollipops because that's all they remember, rainbows and lollipops. And then to see them after the procedure when we give them the mirror and they look at their teeth and they're amazed. These are mine, really? I'm gonna walk out of I'm gonna walk out of here with these teeth? Yes, they're yours. Enjoy.
Is that right? You say they get choked up sometimes when they see themselves with these permanent teeth for the first time.
Oh, it's a huge transformation. We had this lady the other day. She came in very nervous initially. Procedure went swimmingly. Everything went beautiful. When we were finished, she saw her smile in the mirror. She gave me a hug. She went around the office. She hugged every team member that was in the office. She came back. She gave me another squeeze, and then she left, I would say hopping on one foot, but she was very, very happy.
Now, how old can you be to do this? Because isn't it true that if you've been in a denture, let's say 30 years, you don't have enough bone for this procedure?
Well, that's a common misconception, really, because honestly, there is no age limit on this kind of procedures. People who are older want to eat and smile and socialize just the same way me and you do.
Could you be 90 years old and do this?
Absolutely. 90-year-old, it's even more important for them to chew well because their whole life revolves around social events, right? You're probably not working at 90 anymore.
That's a good point. All right.
You want to go to a Christmas party, you want to go to Thanksgiving dinner, you want to go see your kids and grandkids and not worry whether you can eat or chew something. With my older patients, I actually hear stories all the time where they get invited to go to the restaurant. The denture wearers pretend that they don't want to eat. They sit there and they actually they'll say, I'm not hungry. Or
because they can't eat in front of
Because
people?
they can't eat. Let me tell you about the life of a denture wearer, Randy.
All right.
You get up in the morning, you have to go, you have to pop them in, you have to wash them out, then you go have breakfast. You can't really have what you want. You can't have a nice cucumber. You got mesh stuff in your mouth. Then you gotta go run, you gotta wash it out so nobody can see. There are so many women in my practice that their husbands are not aware that they have dentures.
Is that right?
Yes, they have to time their runs just perfectly so the husband is not aware that they have to take the teeth out and put them back in. The kind of stress these people go through, it's unbearable, really.
But I know a couple denture wearers, and they seem fine.
Sure,
They
they're
never
fine.
complain.
They don't complain to you, they complain to me, you're not the dentist. But life of a denture wearer is not a comfortable life. And before maybe you had to, now you really don't. Now there are so many much better alternatives.
So this is the newest, hottest trend in dentistry.
Absolutely. Walk in with a denture, walk out with non-removable teeth that are yours that you don't have to worry about. Walk out with your old failing, we sometimes call it terminal dentition, and walk out with beautiful, healthy, nice smile.
Now, but what about the people that have really bad gums, like gum disease, right? Are their gums good enough to do this? That means their teeth are falling out. Can they get dental implants?
Yes, and those people are actually one of the reasons people don't get implants is because of that, because they've been told by other dentists, by other doctors, there are even some medical doctors that you can't have that procedure, your gums are bad. Well, what we found is once the teeth that have all that bacteria, all that mold are out, your gums are healthy. We can place implants. We can give you something that will be healthy that you don't have to worry about, that you can smile confidently and feel good about yourself.
So you brought some photos.
Yes, Randy. Now, this wonderful lady came to our office, and the story she told us was really an amazing story. She said, Dr. George, I have a lot to be grateful for in my life. I have great kids. I have wonderful grandchildren. I'm working. I love the job that I do. But none of the people that know me because I hate my smile. They all think I'm angry.
Is that right?
Yes, they all think that I'm upset about something. It affected my life to the point that I don't even want to get out of the house unless I absolutely have to, because I don't want to smile. I don't feel confident when I'm talking to people. And that's not me. That's not who I am. I'm a happy person inside. I've always been.
They say this on the consult?
Oh, absolutely. Sometimes tears start flowing at the consult because all that built up angst just comes out. They've been living with this for years. They've hated their smile, or they've hated how they feel for a very, very long time. And now they see that there is a light in the end of the tunnel, that it doesn't have to be that way, that they can just go back to enjoying life. They can actually realize that this appointment, this consultation, is the first day of the rest of their life. And
nice.
It's very
so
rewarding.
what was going on with this woman here? It seems like a forced smile in a way on the before.
Yeah, absolutely. We had to teach her how to smile. She forgot how to smile. She didn't know how to do it. Well, we literally had to coach her. You got to put your lip up, and you got to make the corners of your mouth go up. And it took us literally a few minutes before we could get even that.
Was she a denture wearer, or she was headed to dentures in this case?
She was a denture wearer.
Okay.
She was a denture wearer. She had flipper. She lost a couple of teeth, had a flipper, wasn't happy with the flipper, thought that this is okay, this is what I have to live with. That's kind of what people do. So look at the after. You see how her lip is relaxed, how her whole face is relaxed.
Yeah.
Because her muscles are not stressed anymore. She doesn't have to hide anything. Her lips, she actually has lips now. Look at the before and look at the after. You can't even see that she has back teeth. And now look at her after. You see a nice, pretty smile that is age appropriate, that her skin color appropriate.
They look real. I mean, that's for sure.
They are real.
And I'm not trying to side with you. People need to know. I mean, I'm not trying to side with you. I'm just asking the questions. But this does look good. It looks natural.
Well,
are you in on the design of the teeth part?
Thank you, Randy. Well, yeah, of course. We are kind of like architects. So there is a lot of, we're talking about teeth in one day. But there is a lot of preparation that goes into it. We have to design the smile so it looks appropriate for the person, that it's not too wide, that it's not too big, that it's not too small, that it's appropriate for the person sitting in front of you. We don't want to just give teeth off the shelf and put them in somebody's.
So how soon can she eat after it's done?
She can eat right away, Randy. And she can eat stuff that she hasn't eaten for years. She can eat a salad. She can bite into a peanut brittle. She can eat candy.
So nuts, I mean, nothing is off limits?
Nothing is off limit. You can go to a movie theater, get a popcorn, and enjoy it while you're watching the movie.
Now, what do they like the most? Do they like the part about eating whatever they want, or do they like the way it looks?
Well, we get all different kinds of people. And some come in and say, look, I don't really care what I look like, which I found is actually not true. Everybody cares what they look like. Okay. But you know what? It's a side benefit. Some people want to look better. Some people want to chew better. Well, here you get both. You get best of both worlds. You chew better, you chew what you want, you eat what you want, and you also look 10 to 15 years younger, sometimes even more than that. Let me show you this next patient.
All right.
Salt of the earth guy, joke after joke, came in, loved to play hockey, had a couple of teeth knocked out playing hockey, had dentures, had flippers, nothing was fitting well. He was one of those patients that we talked about who said, you know what, I'd like to look better, but for me, I just miss the steak. I just want to bite into a nice juicy steak. He already had dentures. He knew he didn't like the dentures because he couldn't eat what he wanted. It was affecting his life. He said, I can't even laugh out loud because I'm worried that they're gonna come flying out. And I can't eat what I like. I just want that juicy piece of steak. Well, let me tell you, Randy, once we were done, me and him, we went out for a steak.
You ate together?
Yes, we ate together. The smile on his face, when he bit into that first piece of steak, it could light up this whole studio.
Is that right? So
Absolutely.
With him, so you're saying like as little as 4 implants, they get a full arch of teeth?
Yes, absolutely.
And they're not snap in, snap out. These are fixed teeth.
These are fixed teeth that you never have to take out, that you never have to put in a little jar. You never have to worry about them coming out. You can confidently bite into whatever it is that you like to eat. And you can laugh, you can kiss, you can do anything you want to do. Now, look at the after, Randy.
That's nice.
Look at the wonderful smile. Look at the confident smile. Because this man knows that he can go anywhere he wants. He can go to the restaurant. He can order whatever he wants. He doesn't have to pretend he doesn't want to eat. He doesn't have to order mashed potatoes or overcooked pasta. And he can enjoy his meal, and he can laugh, and he can yawn, and he can just go about his business and not think about teeth, not think about covering his mouth. That is him. These are his natural teeth that feel, look like his teeth.
Now, for people, and we talked about this, is this one of those things where people say, I should have done this a long time ago?
All the time. I have some patients that have done dentures years ago, and they come to the office and they tell me, why didn't you talk me into doing that earlier? Well, you know, dentists we don't want to pressure people into doing treatment, but now that we do all these wonderful procedures and we see the difference it makes in everyday life of people, how it changes their life, thinking to myself, why didn't I talk them into it
What
earlier?
kind of training do you have in this?
We spend hours and hours learning how to do this stuff, Randy. We've trained in some of the best institutions in the world. We trained at NYU, we trained in Sklar Institute in Miami, we trained in Las Vegas Global Institute, which is the leading institution in the world. There are very few dentists, as a matter of fact, about only 250 dentists in all of North America who are graduates of that institute. And all of that knowledge combined.
Is there that much to this, by the way?
Oh yeah, absolutely. You know, we make it look easy, but there is a lot of preparation and a lot of education that goes into it, so it comes out right, and that it's comfortable, and that it's functional, and that it lasts for a long time.
Is there more men or more women that are coming in to do this?
I see more and more women doing this.
Because men put it off, right?
Well, yeah. Men put it off, and sometimes women are the driving force in the family. They are the go-getters. They are the ones that actually, they'll do it, and then they'll bring their husband and say,
Is that
you
right?
guys,
Is that
oh
common?
yeah, absolutely. That's how it usually works. Look, I did this. I can't believe I didn't do this earlier. Now you gotta do it. And sometimes they have to drag their husband with them, but then the husband goes, oh my God, where were you? Why didn't you make me do this earlier?
That's good. That's good. Okay, so we have time for a few more photos. What else do we have?
Oh, this is one of my favorites, Michael. Michael came in, had an accident, car accident, had teeth missing after car accident, had work done, didn't like how it came out, had more work done, still not comfortable, still not the way he wanted to look. And he's in sales position. He said, when we first met, he goes, Dr. George, I have to talk to people. I can't sell stuff if I don't feel confident in what I'm saying. And whether it's true or not, I always think that people stare at my mouth. I can't do this anymore. So we had a consultation. All the options were presented to this patient. One of the options was a denture. He didn't want a denture. He said, I already have one. I don't want to be taking teeth in and out. I don't want to
So
be
that's why they
thinking-
come to you. I mean, you're known in your area for this?
Yes, that's what they come
Okay.
for. He didn't want to worry when he's kissing his wife whether his teeth gonna move or whether he needs to think about that or not. He didn't want to worry about that when he's talking to his prospective clients. And look at his after.
Let's take a look. Yeah. That's a nice big smile.
Isn't that a happy man? Now look how natural his smile looks.
Yeah.
You will never guess that his teeth were even done, that anything was done to them. And his personality shines through this photo. He's a confident man that can do whatever he wants, that can chew whatever he wants, that can speak to whoever he wants.
I mean, because he's a young guy. To be
Yes.
wearing a denture, that would have been terrible.
That would have been terrible, but you know what, Randy? We have people who lost their teeth when they were 30, when they were 40, and they've been living with this removable stuff that comes in and out for many, many years. And for one reason or the other, they just never went for it. Now there are better alternatives. They can live their life and not worry about teeth.
Now, we should mention, I guess, Medicare, Medicaid does not cover this here in the U.S. Is that right, dental implants?
That is right.
Even the best insurance is only going to cover a small portion.
That's
so,
correct.
do you offer financing, payment plans?
Yes, we actually have a dedicated person in our team who takes care of all of that for the patients. They apply for the financing. They figure out together with the patient. That person is kind of a patient advocate. They sit down, they figure out with the patient what's the comfortable budget, monthly budget is for the patient, and there are no more excuses, Randy, because now this stuff can be financed.
So you're not too old, so you could be 90-something and do this.
Absolutely.
What's your oldest patient?
96.
90, now, why would a 96-year-old want to do this?
Because she wants to eat just like me and you, Randy. She wants to smile just like me and you. She wants to go about her life just like me and you. Now, because she's 96, her choices are not as wide as mine. She can't play soccer on a Sunday, but she does, and she wants to eat with her family, and she wants to smile, and she wants to enjoy the company of her friends and family.
So how soon, like the process, how soon can it be done? If they're watching it today, could they have their teeth in a couple of months?
Randy, they can have their teeth in a couple of weeks. Somebody watching us on TV now can be chewing, smiling, confidently, comfortably eating whatever they want 2 weeks from now.
Is that right? So it's pretty fast. Now we're going to take a quick break. We come back and we'll have time for a few more of those photos. Perfect. You're watching the Wellness Hour. According to my first guest, no more dentures. We'll be right back.
So one of the things that happened to me was I was in a car accident about 10 years ago. I lost about 6 teeth in the front.
He went to a few doctors. 6 of the teeth that were gone looked completely different from everything he had in the rest of the mouth. And I said to him, after 30 years of being together, you have to get your teeth done and you have to go to Dr. George and Wanda and get them done because you're gonna look fantastic.
I got porcelain veneers. My smile is amazing. I'm a pretty happy guy.
When I first looked at myself in the mirror, I didn't recognize myself because I had a full face.
I had one lady say, "Oh my God, your teeth are so perfect."
I look better. I feel more confident.
We spend a lot of time trying to find out what's important for the patient to deliver the best care possible. If we cannot help you, that first visit is on me.
Call Advanced Dentistry. You'll be glad you did.
The quality of life afterwards is amazing.
For more information on how we can change your life, visit us online today.
You're watching the Wellness Hour. I'm Randy Alvarez. News that makes you healthier. We're discussing replacing missing teeth with dental implants. According to my first guest, he says if you've been told your teeth need to be extracted and you need dentures, he said, don't do it. You need to get a permanent set of teeth with dental implants. And if you're wearing dentures, he says no more dentures, no more traditional dentures. With us, we have calls himself Dr. George. Dr. George, welcome back to the program. It's Dr. Sepiashvili.
Yes.
Is that right? Okay, good. Now, because I guess you work with your wife, she does the same things. They call you Dr. George and they call her?
Dr. Wanda.
Dr. Wanda, okay,
Yes.
good. So you have more photos. What are we looking at?
Yes. Look at this young lady. We literally could not get her to smile. She was very uncomfortable with the way her smile was. She forgot how to smile. She was congenitally missing some of her teeth. Believe it or not, Randy, people assume things about you when they don't know you. They assume things just looking at your smile. They assume you're not intelligent enough. They assume you don't care enough.
Like if you have bad teeth.
Yes, if you have.
Like you're discriminated against. Like
Absolutely.
You're poor.
Look,
okay.
all the villains in the movies have terrible teeth.
That's a good
Right?
point. Yeah.
So people will make assumptions about you. If you think about it, you go for an interview, and you have two sisters, and one of them is sitting there saying all the right things, but sitting there with a frown on her face, and another one is smiling, confident about her smile, confident about herself. Who are you going to hire?
Yeah. Well, at least the one that looks happy.
Absolutely.
Right? And enthusiastic.
Enthusiastic. That's the key word, enthusiastic.
So with her, she would definitely, you would have an opinion about this person.
Yes.
Doesn't look like a happy person.
Does not look like
so
a happy person.
this is a young person. She was headed to dentures?
Yes, because she was missing some teeth, wasn't comfortable with the way her teeth came together, wasn't comfortable with the way they looked. And take a look at her after. And in one afternoon, Randy, she walks out like this.
Very nice.
You know what was the first thing she said? My God, I can put lipstick on now. I don't remember when was the last time I put a lipstick on my lips, because I never wanted people to look at my mouth, because I didn't feel confident about the way my teeth came together, the way they looked. So
it has really changed her appearance. There's no doubt about it.
It changed her life, not just appearance.
I mean, it seems like a no-brainer. I'm not trying to side with you, but it sounds like, why not this?
It is a no-brainer.
It's just they're afraid? Because people don't like going to the dentist, I guess.
People are afraid. People don't like going to the dentist. People think it's way too expensive.
But if they knew how easy it was, do you think they would all do it? You couldn't even handle the business, right?
Oh, yeah, absolutely. I'll have people knocking the doors down. running into the office.
So we're short on time.
Oh, just one more.
Okay, one more photo.
All
We have about 30 seconds.
This beautiful lady came into the office.
All right.
And she's been a denture wearer for 10 years. Hated the dentures. Same tooth kept popping off the denture. Denture was coming in and out. She's very athletic, likes to play sports, likes to coach. Couldn't do it confidently. Was always worried that the teeth gonna come out of her mouth. Couldn't chew what she wanted. Didn't like the way her face looked. Let me show you her after, Randy.
Very nice.
Her whole face looks different. She looks happy. She looks slimmer. She looks confident. And she is confident. She can eat what she wants, not worry about those teeth coming out. She can smile. She can play her sports and not worry that the teeth gonna be left somewhere on the field. When we were finished and we gave her the mirror, tears started streaming down her face. I got chills just thinking about it. She was so happy, she couldn't believe it. She kept putting the mirror down, looking back in the mirror, putting the mirror down. She said, "These are mine. I don't have to take them out anymore."
That's nice. That's a good story.
Yeah.
Now we're out of time. Okay, so if somebody, final message, somebody watching this, their teeth, bleeding gums, bad breath, loose teeth, crumbling, they know they don't want dentures. The other group, they're already wearing a denture, but they're afraid of this maybe. Maybe they're still skeptical. What do you say to them?
I say you do not have to live your life and worry about your teeth. You can eat what you want, you can smile confidently, you can date again, and we can do that all in one day.
So they could come in, meet with you on the consult. They get to meet with you or your wife on the consultation.
Yes.
Is that right?
Every consultation they meet with me or my wife.
Okay, good. I want to thank you for coming on the show. Very good. And they go to your website and see all these photos.
Yes.
All
Thank
right.
you very much. Randy.
Thanks.
It's been a pleasure.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.